Caleb Costa is our next speaker. He leads the client services team at InCrowd. He's spent the last 5 years specializing in healthcare-related market research while building and commercializing innovative products and services for the industry. Sadly, Caleb remains true to his Yankee-loving roots, even though he now lives in a Red Sox-loving world. And Caleb brings passion to everything he does. I'm excited to hear his presentation on delivering healthcare provider insights at the speed of business. Please join me in welcoming Caleb to the stage.
Thank you, Janet. You know, I have a confession to make. It's the first time I've had an opportunity to talk at a TED-style event. So, force of habit, I did some research online to understand a little bit more about what makes a great TED Talk. And it turns out there's a group called the Science of People that pulled together 800 participants, just shy of 800 participants that watched thousands of hours of TED Talks, and they came up with a short list. And I'll share that list with you briefly. First is, can't script it. Second, you have to smile, although I would imagine there's some kind of a cap on that. Apparently, the more you smile, the more intelligent people think you are. And my personal favorite, and this is probably because of my Italian heritage, is hand gestures. The more hand gestures, the better. 465 hand gestures, in fact, led to the highest ratings. So bear with me, because if I don't get enough in between now and, say, minute 16, I'm just going to break into jazz hands. I haven't been the first person to get up here today and talk about how quickly the healthcare environment is changing. And I'm sure I won't be the last throughout the entire day. Anybody have any idea how many drugs were approved by the FDA in 2014? Yell out a number. 41. Very good, 41, that's correct. How about biologics? There were 10 biologics approved by the FDA's Biologics Division. What about supplemental approvals? Supplemental approvals are things like new indication, changes in labeling, patient population changes, et cetera. There are actually 50 kinds of supplemental approvals. There were 3,170 in 2014 alone. And that's just the drug side of things. If you look at medical technology, I saw a really interesting stat online recently that in Europe alone, every 38 minutes there's a new medical technology patent filed for. So this kind of a market, this kind of a moving target, if you will, requires more information quickly. And part of what we do, and many other companies are focused on doing now, is automating the process. Getting us to a place where we bring information from the people that have it to the people that need it in a more automated way. And at the core of automation is user experience, making this process as focused on 3 elements: ease, efficiency, and engagement. This is one of my favorite examples of user experience. There's a difference between designing a great product and designing a great experience. There's also a difference between designing an incredibly methodologically sound research instrument and that instrument requiring quite a bit of that to be able to complete. So, you know, when designing a research experience, when designing an experience, it helps to understand the people we're designing for a little more deeply. We asked 275 physicians, the last 275 we signed up, what their biggest obstacle was in 2015. Not one mentioned complex disease or patient adherence, some of the stuff that we know are big issues. Majority of them, nearly 80%, talked about the business of healthcare being the big obstacle. We also know that physicians, now 90+% of physicians use mobile reference apps while at work, and 40% of them are even going online during patient visits. So we've got a technologically advanced user that has a particularly frustrating and complex day job. So as researchers, we ask some more questions. let's understand a little bit more about how do we build the experience. We asked, first, unaided likes, dislikes about market research. And then what you're seeing in front of you here is ratings on a variety of different methods. The sample was half internal and half with our strategic partner WebMD. Doctors had to have recent experience with both qualitative and quantitative to screen into the exercise. And what we see is that these are the 9s and 10s, the top 2 box, what you might call the lovers of each of these methods, right? And so what we see is that more folks are loving the surveys, the shorter the better. We'll dig into a little bit more about why in a bit. Before they answered that question in an unaided fashion, we asked, what do you dislike most about market research? Perhaps the most surprising thing to me about this was that 3.6% of all of them said they didn't get paid enough. When traditionally in market research, we're having trouble fielding something, what do? We increase the honoraria. That's our first lever, right? Pay them more. When the reality is that the single most important thing to them, the single most compelling thing that they dislike, that destroys the user experience, is complexity and redundancy, followed by time. It takes too long. These are the things they dislike. So we needed to dig into this complexity and redundancy question a little bit more. We looked at the last 120,000 questions asked on our application to see if there was further evidence of this complexity issue. About 1% of those questions yielded a dropout. In this case, the proxy for complexity and poor user experience being the dropouts. And what we saw was that as their questions became a little bit more complex, your user experience seemed to be turning a little bit as well. The lowest rate of dropout came up on the multiple choice single answer question. When you move to the matrix question, where they have multiple inputs, 4 times greater dropout. You move to a force ranking question, 6 times greater. Multiple short answer questions yielded a 10 times greater dropout rate. So complexity, ultimately, caused us to now believe that the more complex, the worse the experience. Well, we talked a lot about what they didn't like. Let's talk a little bit about what they liked. These were the unaided responses. What was your most preferred method? Nearly 70% liked surveys most. Why? Convenience. I can do it when I want. How do we make it better? Got to make it more concise and easier. About 25% said interviews. Why? Because I can provide the detail and nuance in an interview in a straightforward way that I can't in a quantitative exercise. And the #1 thing we could do to improve that, flexibility in scheduling. Given the amount of marketing and/or research people in the room, I'd be remiss if I didn't give you guys something a little bit more actionable to take away. So the final question we asked was this. In an ideal world, well, ideally, how long would a qualitative exercise take for you? And then ideally, how many would you participate in a month? Followed by ideal length of survey, and ideally, how many would you participate in a month? In terms of the timing, there was actually no statistically significant difference between any of the samples around timing, how long they thought it should take. So it's a good proxy, right? 30 minutes for qual, 23 minutes for quant. However, when we dug a little deeper into the data, we saw that there were significant differences in the volume or amount of times our physicians and WebMD's physicians were particularly interested in participating in the research. So the internal crowd, the folks that are kind of used to the micro experience, if you will, were willing to participate in 11 qualitative exercises as compared to 6 for WebMD. And quantitatively, if you look at the lovers of the microsurvey, and this was across both samples, they were willing to participate. These were the 9s and 10s you saw earlier versus everyone else. They were willing to participate in 15 versus 9 quantitative exercises. So again, we start to see this movement, this idea that if we can build the ideal experience and strip away some of the complexity and the time issues, we'll get people to answer more than they have been. Let me leave you with this thought. Forbes came out with an article a couple of months ago where they looked back at the Fortune 1000 companies from 10 years ago. 70% of the companies don't exist anymore. And the number one reason they don't exist anymore is because they were unable to be agile. They weren't able to move as quickly as the markets they were in. So take 2 things away today. First, talk to your customers more often and specifically on their terms. And second, next time you sit down to design a research instrument, think about how hard the respondent customer is going to have to hit the bottle to complete the exercise. Thank you.
Questions for Caleb?
Thank you. I was just wondering, I mean, I agree the complexities. I have a friend who's a doctor who looks at these grids of questions and says, after a while, they all look the same, like you said. Are there certain types of studies that are really off limits to microsurveys, like a segmentation where it's just so complex and you have to look at so many different dimensions, or that you need a lot of questions? Or is really any type of marketing research study, can it be streamlined and put into a microsurvey format?
It's a great question. I think that eventually we'll get to a place where nearly any method will be shortened and made more concise. There are some, extended conjoint exercises and other types of methods that are particularly difficult. However, there are groups out there that are working to shorten them and make them, provide a better user experience using technology. I think the onus is on us to do that too, on everyone in this room to make it easier. And that's really the goal. My brother's actually a physician, and him and I talk a lot about the research we provide. And he said to me, I remember one day after I showed him one of the exercises, this was back when I was in traditional market research, it was a really complex conjoint exercise, and he took the exercise and he turned to me and he's like, "Yo, you're the S guy." I said, "S guy? What are you talking about?" He said, "Well, you're the guy who decided to put the S in the word lisp." I looked at him and I'm like, he said, "Why do you got to make it so difficult? That's just what's the deal?" So I mean, sorry. I do think that there are some exercises out there that are particularly complex to tighten and shorten into a microsurvey. But as you see, your average time is 23 minutes, right? So while we specialize in 5 to 10 minute surveys at InCrowd, I think there's a whole host of opportunity out there for the 10 to 23 minute survey that could yield a better user experience.
Have you had an opportunity to compare the outcomes from, say, a segmentation done this way with one that's created by some of the segmentation on the fly engagement data outputs? That is, now we have automation creating segments based on engagement data in comparison with the way we've always been doing it.
Well, we actually don't do full-blown segmentations, so we haven't compared that piece of it. However, I've personally been a part of many of those projects before I joined InCrowd, And oftentimes there are typing tools and things like that that come out of the back end of those exercises. And so what we do is tend to model method. We take that typing tool and we'll run a series of people through it so that we kind of work in partnership with some of these other methods, and they're then able to take the segments and run questions through in a much more immediate fashion. And a lot of our clients use us in that way. They kind of segment people behaviorally based on a micro survey and then come back and ask them more and more questions.
Other questions for Caleb? The question man.
So I guess I want to start by commending you for a presentation that I think all of us vendors in the audience can take a lot of notes and think hard about. So thank you for that.
You're
When
welcome.
you talk about complexity in surveys, and it's a very intriguing, and it's been a sort of a, you know, a hobby horse of mine to try to, you know, make it more conversation. You know, when you design surveys, it's so easy to say, thinking again about the thing we asked you to think about before. Obviously, there's some dimensions of complexity which are very straightforward. How many different rows and columns do you have, and how much language you have? But have you looked at all, or what do you even think about the impact on user experience of things like gamification or, you know, image-related exercises as opposed to word-related exercises? That all those other things that can, you know, sort of impact the psychological experience of the respondent. That's my question.
I mean, the short answer is yes, and there's a whole host of people out there that are doing this kind of work, not only in healthcare, but in CPG and a lot of other areas around, you know, the idea of, even on a rating scale, being able to slide something up as opposed to actually, you know, hitting a radio button, et cetera. And we see that, you know, that third E, engagement. The more engaging you can make the survey, the better. We also know that, especially in a short survey scenario, if you want to help mitigate dropouts and you're going to ask complex questions, you ask them at the end of the survey, not at the beginning. Because if respondents have a little bit of skin in the game, they've gotten 75% of the way there, that complex question, they're more willing to take. So I think the key is focusing on the 3 E's, right? Anything that engages them more effectively, stimulates them, is educational in some way. That's what our physicians are telling us they want more of. So certainly, I think that plays a big role in the engagement factor.
I have a question. Have you found a correlation between the length of the survey and the quality of the data? Are you able to quantify that?
The length of the survey and the quality of the data. I do think that there's this concept of shortening attention spans, that if you look at even some of the biggest medical schools in the country, they have programs now and classes that are designed to help physicians focus. I think we all know attention spans are shortening. So with regard to asking a short question and delivering great insight, I think I'd personally rather have 90% of somebody's attention for 5 minutes than 5% of somebody's attention for 90 minutes. And that'll speak to the quality.
Any other questions for Caleb? One last question.
So you said only 3.6 said they were disliked the amount they were getting paid.
Yep.
For the surveys. To what extent is there a correlation? I expect there to be one, but to what extent can we dial back on honoraria if we're doing shorter surveys? Or is that not part of the negotiation?
Well, so the 3% is actually across the whole sample, not just the micro survey folks, but the folks that are also coming from you know, the WebMD world, which arguably puts them into the running for any kind of survey or qualitative experience. And so they were asked that question focused on all of research. You know, what do you dislike most about research? When you're only asking someone for 5 minutes, you don't have to pay them as much. When I'm asking you for 20 minutes or a half an hour or 30 minutes, you have to pay them more. What we've found personally, though, is when you figure out ways to make research engaging and allow the physicians to do a couple of things that we know they love to do, which is learn about what's coming up the pike, see what their physician peers are talking about regarding the same topic. When you build these elements into a research opportunity, you can actually pay them a lot less.
Thanks so much.
All right.